got a friend in you. I know you are so. You are my confidence. You are my closest friend. You are my.
Hello viewers, you're welcome to your very interesting program, Tammy and You. And today we have a very interesting topic to discuss, which I know concerns every one of us. And that is dental care. How much do you care for your teeth? Do you take it serious? Do you visit a dentist? Have you ever even visited a dentist? Okay, just come with me. And today we have with me here Dr. Obafunke Deloye, who is a consultant pediatric dentist. She's also an associate professor at the University College Hospital. Dr. Deloye, you're welcome to this program.
Thank you. Good day, viewers.
We're talking about dental care. What do we really understand by dental care?
Dental care, like general health care, has no specific definition, but from my own point of view, it's anything we do in an individual does to maintain oral health. It's not just the teeth, because as you know, in the mouth, we have the teeth, we have the gums, we have the tongue, we have what we call the mucous membrane, that is the inside of the cheek and the floor of the mouth. And anything we do to maintain health in the oral cavity is actually dental care. It's more than visiting the dentist. It can be dental care, can be home care, can be hospital care. Depends on what the individual needs.
So what or how important is this to individuals?
There is a popular saying that the mouth is the mirror of the body, and it's also the gateway to the body. And like every gateway, the gateway has to be good. So if the oral health is not good, then the body will not be healthy. So it's very important. Everything God has made is important, no matter how small. So the mouth is as important as the eye, is as important as the heart, is as important as the hands, as the legs. The mouth is very important because, as I said, it's the gateway to the body. And if the gateway is not healthy, then whatever goes in will not go down well. We all know that when we eat, digestion starts from the mouth. So if the mouth is not healthy, digestion won't start from the mouth. And if food is not well digested in the mouth, then it affects absorption in the body. And the individual may not look too healthy. So the mouth is very important. And there is a saying, I won't say it in Yoruba, I will give you the interpretation that when you see somebody, the first thing you see in most people is you see the teeth.
Okay.
Far away, you see somebody smiling at you, and the teeth attracts you. And you want to come close, you want to smile, you want to respond.
Okay. They send you packing.
Oh, they send you packing. You see somebody far away, this person smiles and the teeth are scattered or dirty or whatever. Or the mouth is smelling. You don't want to come close to the individual. So the mouth is very important to every individual, either old or young.
I was just going to that. I was going to say, who needs the care? Because we find out most times, we actually think until you get to a particular age, you don't bother taking care of your teeth. Or, children, just children. They don't need care. Who really needs the care?
Like you introduced me, I'm a pediatric dentist. That means I look after children. Like you have a pediatrician looking after the welfare, the general health of a child. Like I said, the mouth is very important, and as I said again, is the gateway to the body. Everybody needs dental care, right from when you have a baby till God decides to call us. So because when you have a baby, you have a newborn baby, the baby starts to feed. You need to keep their mouth clean. It's not using a toothbrush because a newborn baby has nothing apart from the gums and the tongue, but you still have to keep those clean.
How do you keep those clean? No teeth there.
Yes.
So how do you not keep the gum and the tongue clean?
Like we teach mothers, when you have a newborn baby, you clean the mouth after every meal, every breastfeeding, with cotton wool and maybe just water. The mother wraps the cotton wool on the first finger, and just takes that round the cheek, the tongue, to keep them clean and healthy. It's very important. But most people feel They are not important. They are very important. And the earlier we introduce children in particular to a good habit, the better for that child. If we do it regularly, when the child brings out a tooth, it's a routine. It becomes a routine. There is no hard and fast rule that it is at a particular age. It starts from when you have a baby and goes straight on to when we die. It can be 150, 200 years. So we start oral hygiene right from the beginning. And when we talk about dental care, it's not just oral hygiene, because what we eat also determines how healthy our mouth or the teeth or whatever is in the mouth is. Okay. Nowadays, from our observation, many of our children are not eating well. Wow. At all. And I think the fault is the fault of the parents. Many mothers, many fathers are busy running after money, and there is no time to cook good meals. When we were growing up, in the morning you have good breakfast. We come back from school, lunch is ready, and dinner is ready at the right time. But when you have both parents going out from 5 a.m. to come back almost 10 p.m., who does the cooking? And these children end up eating whatever is available. And again, many children are lazy when it comes to eating and feeding. Anything that requires chewing, they don't like it. But something that is soft or sweet is what they want. So that is why noodles are thriving. I'm not against them, but they are thriving because cooking of noodles is very short. Within a short time, it's ready. Many children love noodles. Children love what is sweet. And if we don't curb it early, if we don't stop it early, it will destroy their teeth. We see a lot of that nowadays. Most parents believe that if the child does not take sweet every day, they haven't treated well. And I believe that why they do this often is because they are not available. Parents are not available. So it's like a bribery thing. They are not there, so each time they come back from work or from wherever they've gone to, they want to give something that they think the child will say, this is good daddy, this is good mommy. And they end up giving sweets and chocolates or whatever. They are all available. We are not saying children should not take them at all. No, they can, but we want them restricted to meal times. Okay. That is, if a child takes his or her meal, breakfast at a particular time, if she has to take anything sweet, it has to be immediately after that meal. The same thing with lunch, takes lunch at 2 o'clock. Immediately after finishing the lunch, the child can take sweet, can take biscuit, can take cake, anything the child likes. And it's not only the solids, because these are our observations. Many children don't drink water again. Do you know that?
Oh, yes.
Have you observed that?
I have.
They don't drink water. There are so many drinks. I shouldn't mention names. There are so many drinks, and the catch in those drinks are the manufacturers will say contain vitamin C, contain vitamin C. What I tell patients when they come is vitamin C, you find them in your fruits. Encourage these children to take fruits. If they have to take orange, I prefer the child taking orange as a fruit than going after orange juice. Give them good breakfast, pack food in their basket, and give them water in their water bottle. Let them go to school, come back for a good lunch. With that, it will keep the oral health very healthy, especially when it comes to holes. Holes in the teeth is the commonest dental problem we face. And they're expensive to manage, very expensive.
Yeah, I was going to come to that because, we're talking about dental care in the house, at home,
yes,
and dental care in the
hospital.
So, are we saying that once you have dental care at home, you actually don't need to go to the hospital for dental care? Or what exactly are we talking about?
Well, dental care at home means what you do at home to maintain oral health. Okay. Dental care in the hospital is what the dentist will do to improve on what you have done. At home, the basic thing we talk about is toothbrushing, oral hygiene. And from studies, we have found out that when we brush at home, including adults, there are some areas our toothbrushes will never get to. So we end up accumulating debris in those areas, which can harm in the future. So when the person comes to the clinic, those areas will be cleaned by the dentist because we have special instruments. for this cleaning. So when we talk about dental care at home, it has to be supplemented with dental care in the hospital. That means you come for a routine checkup without even problems when the patient or when the individual has no problem, at least once a year. We always say twice a year, but at least once a year. So for the children, the way I do it, because they may miss school, so I always tell them come during the long back, beginning of long back, which is about July, yes. And I tell them come again at Christmas holidays. So that way they come during holidays. They don't have to come when they have to go to school and miss school.
We're coming back again, and I'll come back to that same question. How often should you visit your dentist? Okay. Viewers, we're just going to take a short break, and we're going to hear the views of people outside on the streets. Do they go for dental care? Do you care for your teeth at all? We just want to see and hear what others say on the street. But don't forget that you can join me on Facebook. Just go to Temi and You, and then you can actually put in any question you have, or you can actually write a comment on Temi and You. At the same time, you can write me on the email address that will be scrolled on after this program, or you can give me a call on that same number. Thank you. We'll be back.
For me, I don't think I need my hair.
But normally the doctors used to say that you must have a routine, a dental routine. You see on your teeth.
I think I've done that like 3 years now.
You have one should be every 6 months.
Because I don't have anything left, I don't bother myself. But I will try and do.
Okay, thank you.
You're welcome back, viewers, and I'm sure that you've had some nice comments from viewers outside. Very interesting comments, really. But we're back to the studio, and then I have with me, like I said earlier, Dr. Temloye. We're talking about oral hygiene before we left at home, the home hygiene. Can you explain it again? Because we're looking at what do we do? Dental care at home, dental care in the hospital. How important are these to them?
For the home dental care, like I said, right from when a child is born, the oral care starts from then, and we advise mothers to wrap cotton wool on the finger, the first finger, dip it in water, warm water, and just clean the tongue and the cheeks. As soon as a tooth or two teeth, especially the lower front ones, as soon as it starts coming out, we advise that mothers should buy baby toothbrush. We've had cases where mother will say baby teeth, toothbrush will spoil them. No, they don't. The toothbrush will remove debris from the surfaces of those teeth. So as soon as the first two front teeth come out, they are baby toothbrushes. The heads are very small and the bristles are very soft.
The cotton wool cannot do that again?
No. The toothbrush will be introduced to the child, and the mother cleans those two front teeth. By the time you have what we call full complement of the primary teeth, that is by age 3, definitely the child should be used to using the toothbrush every day. And by the time they're age 3, we advise that mothers put toothpaste. If you look at toothpaste adverts, because they are adverts, the companies tend to put the toothpaste from one end of the brush to the other. We don't want that because children swallow the toothpaste. We advise that we put, in books we say pea size, but when we talk to lay people, many people may not know what a pea is, so we say granite size or bean size. So that is just a tiny bit of toothpaste because these children will not spit out. They swallow it. And too much of swallowing a toothpaste is harmful. So we advise that just a smear or a bean size of the toothpaste should be put on the brush and the child's teeth should be brushed. We want that done in the morning and last thing before going to bed. When a person, not only a child, adults, children, whatever the age, anytime we brush in the night, we should not eat again. The only thing that can go into the mouth is just water. So that means there is no, you tell the child to brush at about 9 before going to bed, and he now says, Mommy, can I take one cake? Can I take a drink? No chocolate drink, no biscuits, no bread, no.
If they do, that means they have to
They go back and brush. And we shouldn't allow it. They should brush and go straight to bed. So it's like from the bathroom straight to bed. And we always tell parents that by the time a child is 18 months going to 2 years, there should be no more waking up to take a chocolate drink. You know, many times our children still eat till late and wake up to eat. By the time a child is 18 months going to 2 years, the mother should train the child not to wake up to eat again. Most times what they take is a chocolate drink, Milo. So we should stop it. It's actually, by the time a child is 2 years, that habit should be stopped. But from 18 months up to that 2 years, what not tolerate, we have to train them to stop it. And the best way to do it, because if you stop it abruptly to children, they start crying and everybody becomes irritable and the whole house will not sleep. So what I advise parents to do is you start diluting the drink. If you put two teaspoons of Milo, 1 or 2 cubes of sugar, 2 teaspoons of milk, you start reducing until you come to water. I actually did this for one of my nephews, and I noticed that it's because they are used to that habit. It's not the Milo they want, but they are used to waking up at 2 and taking something. So when I diluted to water, he was still taking it. He did it until he stopped. So from 18 months, the mothers should start diluting the drink until they come to water, and they will find out that after some few weeks, the child will stop. So we don't want that habit to continue.
What about generally? Now we're talking about visiting the dentist. You said at least once a year, one should visit the dentist.
Yes.
And but at most, we should try and visit the dentist twice.
Yes.
Twice. That includes parents and children, not necessarily just children.
Everybody. Because we have different diseases that can affect different age groups. The commonest in children is dental caries, the whole, because they are the ones with the sweet mouth. But as we start aging, the elderly, the common disease that they suffer from has to do with the support of each tooth. We call them periodontal diseases. And it's usually due to deposits that they have not removed, because those deposits now end up being foreign body. They become foreign body. And because they are foreign, anything foreign is, I don't want it. So the tissues will react to the foreign body, and it will affect support of those teeth. So when they come for their every 6 months checkup and possibly scaling and polishing, those deposits can be flicked off, and the teeth surfaces will be clean. And with that, because there was a time we interviewed some people, and there's a general Yoruba belief that as you age, you must lose a tooth. It's not true. It's a taboo. It's not true. You are supposed to go to your grave with all your teeth in your mouth.
Okay. If we don't, after going to the dental center, what if at home you use a toothpick to get those caries out, or you use a pin? Like some people do. Use the pin or use the toothpick to get caries out of your teeth.
You can see my eyes. We don't advise the use of toothpick.
Okay.
Toothpicks are harmful. They destroy support of our teeth. I want to repeat it. Toothpicks are harmful. The way they are made, some manufacturers just pick sticks and just sharpen and pack for us. The ideal way is supposed to be a triangular pick, which we don't get to buy. We advise people to use dental floss.
Okay.
Dental floss is like a thread. It goes between, especially for dentitions where you have overlapping, where the toothpick will not even go. But you see people forcing the toothpicks into those spaces, and they end up destroying their gums. So you can use a dental floss, which is a thread, special thread. It will go between those two teeth and clean in between. And this area where we're cleaning, toothbrushes normally will not get there. Yeah. So the dental floss can go there and clean in between. We even advise children to be introduced to dental floss in between cleaning. When we talk about holes in children, in most cases they start from in between, where you will not see. In few cases it starts from the surfaces of the teeth, but in most cases they start from in between. So the dental floss will help in cleaning. And the pin, harmful. It is no pin. no pain. I've seen people use pain, I've seen, but as much as possible, I try to discourage the use of such things. And another thing, opening bottles with teeth. I've been to functions where you see me running up and down. Please don't do that. Please don't do that. You see people trying to open Coke bottles with their teeth.
All right, quote my voice on that.
It is
no. Let me just put it
right.
No, you don't do it.
If you should not do it, it is capital no. Your teeth are strong because the outer covering of each tooth is called enamel. Okay. Enamel is the hardest substance in the whole body. It's stronger than bone. Okay. That is why you are able to open those bottles with your teeth.
Stronger than bone?
Yes. Stronger than bone. It's the hardest. That is why you are able to open, and that's why you're able to chew bone.
Okay.
You know you can chew bone.
Yes.
But you see, with aging, they will start cracking.
Okay.
And you won't, the early cracks, nobody knows there is a crack. But there will be a time you will just be eating banana, and that crack will just give way. And you come to the dentist, it was only banana I was eating. The cracks have been there over the years.
Okay, you're talking about enamel. I just remember that with the African culture, we can chew bones. The Europeans cannot chew like we chew. So does it mean that they don't have the enamel? Because you give an European just to crack, they can't do it. And then you start wondering, I have very strong teeth.
Well, it's a matter of our own habits. We were trained to chew bones. You know, when we were growing up, parents would take the breast of the chicken and the thigh, the fleshy ones, and they will give the legs to the children, which is bony. Mm-hmm. So right from early childhood, we have been trained bones. They are used to processing food. So giving them something hard suddenly it's a bit too sudden for them. Most of their food, baked beans is processed. Sweet corn is processed. When I was growing up, when my grandmother makes beans and corn for you, the corn is so hard, you have to chew it. So I think it's our upbringing. We are used to chewing. They are not used to. Everything is processed. Minced meat, processed. This processed. So giving them something hard, suddenly it's like they are not used to it, and they can't chew. We are. But it's necessary we chew. For children, chewing is necessary because it helps with the growth of the jaw. So many children that run away from chewing, that go after drinks, it's not good. If a child does not eat, please find a way of making the meal time interesting. So that
so what do you tell us in just a few seconds? Can you tell us, dental care, is it important in pregnancy as well?
It's very important because it's part of our work to visit pregnant mothers, to talk to them about oral health care. We all know that when women are pregnant, many times they get irritable and then they can't put anything in the mouth. They want to brush, they vomit and so on. If that goes on and you don't keep the mouth clean, during pregnancy it's a time of hormonal imbalance, and these hormones also affect the gum. So if they don't brush, they end up having what we call gingivitis, that is inflammation of the gum, and they can have some growth. We call it pregnancy epilepsy. It's a growth on the gum, which is a sign that they have not been brushing when pregnant. Unfortunately, we can't operate when they're pregnant until they deliver.
And that time might be too late for the
They bleed a lot, yes.
Yeah. Well, I'm sure this is a very wide topic. We cannot finish discussing it today. Oh, we're so glad that you came on this program, and I'm sure our viewers have learned one thing or the other on this program, and we are all planning to adjust our way of life so that we'll not be caught on our way to some of these problems. Dr. Denloye, thank you very much for coming on this program.
Thank you. It's my pleasure.
We hope to invite you again another time.
I'll be willing to come.
Thank you viewers for joining us on this program. Don't forget to check in on our Facebook, Temi and You, and send in your words. At the same time, if you have anything to discuss on email, just send this to my email address, which you see on the screen, or give us a call on the same another address or phone number that's on the screen. Till next time, we'll come your way. Thank you. God bless you.
I've got a friend in you. I know you are so. You are my confidence. You are my closest